About 7 years since President Obama signed his namesake law into the books, Obamacare, and ever since then, Republicans have wanted to throw it out. Well, now they have a plan. So did they get it right? Joining us, Michael Cannon, Director of Health Policy Studies at the Cato Institute. Good to see you, Michael.
Morning.
A lot of Republicans see these tax credits as just another subsidy, an entitlement. What would you use in place of them?
Well, you don't want to subsidize unaffordable care. You want to do things that make health care more affordable. And the one thing that does that is when you give consumers the money and an incentive to shop around for lower prices. When you do that, an experiment in California drove down prices for hip and knee replacements at high-price hospitals by 37%, an average $16,000 reduction. So what we need to do is take the money that employers and government are spending on the behalf of patients, give that money to the consumer, let them choose their health insurance plans, let them decide how much coverage to buy, let them buy portable coverage that stays with them between jobs, and they will put downward pressure on prices and will bring health care within the reach of more people. But that's not what Obamacare does. That's not what the House Republican leadership plan does. They just throw more money at unaffordable care.
All right, well, can Paul Ryan push this bill through both houses? If he can't, what do the Republicans need to give up in order to win the Democratic support? And for the most part, you don't sound too hot on this. Is there anything you like about it?
Well, it does cut most of Obamacare's taxes. It does get rid, or it does increase health savings account contribution limits a little. It doubles them. I think we need to triple them. But look, they're not going to get any support from Democrats on anything related to health care until Congress repeals the Affordable Care Act. That's the source of all this partisanship. If you want to get bipartisan cooperation, the ACA has got to go completely. And if Congress wants to do anything else, they've got to repeal the ACA in full, because if they do a partial repeal or really a repaint of Obamacare, which is what this bill is, then they're going to get bogged down in health care. They're going to have to keep fixing the problems that they've created or failed to repeal for the next 2 years, maybe even 4 years, and Republicans aren't going to get anything else done.
All right, let's talk about the timeline here. Where does this bill go from here? Will we see a plan by Easter, for instance, and then where are we 1 year from now?
Well, President Obama in 2009 kept saying, we want to get this done next month. We want to get this done by June. We want to get this done. It took them 15 months. So I don't believe Republican leaders when they say we're going to get this done in the next 2 weeks and then we're going to have something to the president by May. That's not how Congress works, and that's certainly not how health care works. It's going to take them a long time to do this, and they should do it right so that they don't have to revisit this, so they're not creating more problems than they're solving. I would want to see them get rid of the refundable tax credits, which are really just 90% government spending. Replace that with an expansion of health savings accounts like Senator Jeff Flake and Dave Brat have introduced. And that could shift the $13,000 that your employer spends on your health benefits to you, the worker who earned that money, and free you to buy health insurance that meets your needs, that's portable, and that would put that downward pressure on prices that we're talking about.
Michael Cannon, Director of Health Policy Studies at the Cato Institute. Thank you so much for your insight this morning.
Yeah, thanks, Michael.